be Liz, and this is our presentation on gonorrhea.
Gonorrhea is a sexually transmitted disease. It's caused by the bacteria Neisseria gonorrhoeae. It's also known as the clap. This bacteria is mainly found in discharge from the penis or vaginal fluids. It's an infection. It's a pure infection of the mucous membrane surfaces caused by the virus Neisseria gonorrhoeae. It's spread by sexual contact or through transmission during childbirth. Although that's rare, it is possible. Since there are several strains of Neisseria, the Neisseria virus, it's important that only strains of Neisseria gonorrhoeae are identified as gonorrhea, because misdiagnosis is super easy if it's not caught immediately. It's also considered gram-negative. The virus is a cocci, which means they're intracellular, and they typically appear in pairs. So it's like they're two circular viruses. This virus is also non-motile, meaning the bacterium may show vibrations and may seem like it's moving, but generally there's no direction and does not move.
So humans are the only reservoir for this type of bacterium, and transmission is primary through sexual contact. Gonorrhea only affects humans and is generally carried in moist areas of the reproductive tract in women, but it's also found in the urethra, the mouth, the eyes, and the anus, and we'll get to a little bit more on that later.
Okay, so signs and symptoms. There is a possibility of people contracting the infection for several months without immediate symptoms. However, commonly in women, there are some early symptoms you can catch. They are usually mistaken for a urinary tract infection because the symptoms are similar, but some of the early symptoms are, they commonly occur 2 to 10 days after sexual contact with an infected partner. First symptoms of contact of gonorrhea are bleeding associated with vaginal intercourse, painful burning sensations when urinating, yellow or bloody vaginal discharge. Those are mild symptoms, but for more advanced symptoms, there's what's called pelvic inflammatory disease, and that may also include cramps and pain, bleeding between menstrual periods, vomiting, and fever. Men are known to have more symptoms than women. They're more prominent, and you can catch them a lot easier. They will have a white, yellow, or green pus discharge from the penis. They also have a burning sensation when urinating that may be severe, and they could also have swollen or painful testicles. The important thing, or crucial thing, is that if men don't get treated immediately, they'll have prostate complications and they could get epididymitis. It is possible to contract this infection during anal intercourse. You will see signs about 2 to 5 days after infection, or up to 30 days after intercourse. A few signs include discharge, anal itching, soreness, or painful bowel movements with fresh blood and feces. It can appear up to 30 days after, or 2 to 5 days. It's better to get checked if you feel that the person, your partner that you are with, could possibly have this infection.
So gonorrhea is spread through contact with the penis, vagina, mouth, or anus. Ejaculation is not necessary for gonorrhea to be transmitted or acquired. Ejaculation is the action of ejecting semen from the male reproductive tract. Gonorrhea can also be spread from mother to baby during delivery, thus the picture of the newborn with infection in his eyes. Although possible, non-sexual transmission is rare. Gonorrhea was first thought to be solely sexually transmitted when it was first discovered, but when the infection was introduced into children's institutions, the infection spread extremely rapidly among girls who were just about to reach puberty. It was later discovered that communal baths towels or fabrics, rectal thermometers, and caregivers' hands could transmit the disease or the infection. It was also discovered that gonorrhea can survive in pus on cloth for several days. However, the typical route of transmission is sexual transmission. It doesn't happen very often, but when it does, it's about as serious as regular gonorrhea transmission. Anal sex has a high risk of transmission as well, as Selena covered previously. Perinatal transmission during vaginal delivery typically involves the eyes of the newborn, referring back to the picture. Gonorrhoea primarily infects the columnar and cuboidal epithelium with attachment hair-like structures called villi and anchor onto proteins. And I'll show a picture of that later. Just right here. Endocytosis is followed by passage through the cell and exits through the basement membrane, where infection is held. Antibody production and activity are low, so repeated infections are seen. So for the treatment and prevention and control of gonorrhea, the earlier the diagnosis, the better. Gonorrhea is treated with the penicillin family. If resistant, then ceftriaxone is often used. It is crucial that there is contact with that the doctor or the physicians contact the previous sexual partners for additional treatment so that gonorrhea isn't passed on person to person. Scientists are working to develop a vaccine. They haven't come up with a vaccine yet, but they are working on one. It's been an important goal in the prevention of infection for a while. So transmission of gonorrhea can be reduced by the usage of condoms during intercourse, oral and anal sex, and by limiting sexual partners. And then, of course, abstinence. And due to the frequency of infection and the emerging development of resistance of treatments in the strains of gonorrhoeae, a development of a vaccine has been an important goal in the prevention of infection, like we were talking about with vaccines. Gonorrhea is just a bacteria that continually morphs to combat vaccines and antibiotics, so that's why they haven't been able to develop a vaccine yet. So that's the end of our presentation. Thank you all so very much for watching. Here are our resources that we used, and we hope you all enjoyed learning about gonorrhea.